I'm Lisa Lancaster. I'm with Respiro. I'm professor of medicine and director of the ILD program and clinical trials at Vanderbilt University Medical Center. I'm a KOL in the space of advanced and hypoxic lung disease. I can't breathe. That's what my patients tell me in clinic every day, along with multiple other complaints about their oxygen therapy. And that led us to looking for a solution for these patients. Well, what is the problem and why are patients having difficulty with their oxygen? Well, it's inadequate and inaccurate. It hasn't changed in decades for patients. The outside boxes look about the same, but and the mechanics on the inside are about the same. We're still seeing the same green tanks. There may be a little bit of newer looking plastic, but it hasn't really changed mechanistically in decades. What are the problems? There are problems with dosing, manual adjustment, and location. Well, what do I mean by that? Well, with dosing with patients, it's extremely rudimentary. In clinic, I actually turn a knob on their oxygen tank or digitally press an arrow up and down to adjust the flow rate of their oxygen at rest, and then when they're walking on a level surface in clinic. And then we tell patients, use this amount of flow rate at rest and with exertion when you go out at home in the real world. Well, what does that look like for a patient? Every time they stand up and sit down, they need to manually adjust up and adjust down their oxygen. That's unrealistic. Think about how many times a day you would have to think about your oxygen and manually adjust that and manually dose that yourself. We don't do that with any other medication. Then there's a location problem. They are stationary concentrators that patients use in the home. They generally sit in the hallway or the bedroom of the house, but patients get up, move to another room, and by prescription should be turning up their oxygen when they walk and turning it back down when they sit down. But now their concentrator is sitting back in the bedroom, and it's an impossible ask. My thermostat at home is smarter than our medical oxygen equipment. Why is that? It needs to be fixed. So what we've developed is Auto 2, a revolutionary regulator. That regulator contains the know-how, that smart algorithm that takes information and data from a wearable via Bluetooth connection and uses that data to better understand the patient's oxygen needs and degree of exertion. That data is also captured in the cloud and provides information on patient compliance as well as needed flow rates. And that information is not available to providers presently. So our best efforts and our estimates on how much oxygen the patient needs. What does our competitive landscape look like? Well, presently I can order home concentrators and portable oxygen concentrators, and they're easy to use. And yes, they're available at home, but they're not automatically titrated. They require manual titration. The vital sign data is not available for providers, and the amount of oxygen use is not available for providers presently. There are some auto titrating systems that are available and were developed during COVID, but they're hospital-based systems. They're large. They sit on tripods that roll around, so they're cumbersome, and they're not even available in the US. There are only a few in Canada and a few in Europe. Auto 2 solves all of these problems. It's easy to use. It provides automated adjusting, taking the think and the self-dosing out of the hands of the patient, and provides that valuable vital sign and information on usage, compliance, and both how much oxygen does the patient need in the real world to the provider. Now, critical element of this, the know-how, is in this patent pending algorithm, and that's a unique aspect of our product. Our titration uses that biometric data to better understand the patient needs, titrate according to the body's physiology, and these are the elements that are not being considered by competitors that are in development of auto-titrating systems. So what does our market opportunity look like? It's a huge market, and the unmet need is enormous in this area. I see it every day. The global oxygen therapy market is about $34.6 billion. It's anticipated to grow to over $50 billion by 2030. The North American home oxygen market, out of that, is about $10.5 billion. And then if you take that and our home oxygen therapy market in our target population, which is a population of interstitial lung disease patients, those are patients that have one of over 200 different lung diseases that are progressive that will need oxygen during the course of their lifetime. And if we assume that population, we anticipate a 20% market capture once we go to market in the first 2 years. And we'd price our device at around $2,000 or less. So what does that look like with our competitors? Well, portable oxygen concentrators that are the predicate for our device have comparable products that are $2,500 to $5,000, and patients pay for this out of pocket willingly because they're eager for new devices. The option for purchase or rental is now becoming available, not just online, but also through durable medical equipment companies, and we plan to add that option. There are CPT codes available for all types of oxygen devices that have regularly been in use for years. And we plan to also develop partnerships with our wearable companies in hopes of combining our products together in one package for patients. So what does our roadmap to commercialization look like? Well, first, we're going to start with regulatory consultation this summer so we can better inform our prototype hardware development and ultimately have iterations and updates on the studies. I direct the clinical trials program for interstitial lung disease at Vanderbilt, so we have a ready population of patients to help us understand and road test those different iterations. We plan FDA pre-submission discussions in 2025, followed by clinical trials to inform our 510(k) submission through 2026, and ultimately aim for FDA approval at later 2027 and 2028. I want to ramp up then subsequent to that manufacturing, sales, and marketing. Our fundraising goals are mainly non-dilutive to begin with, progressing to seed and angel funding, followed by VC funding as we develop our product. We believe that it will take between $1 million and $1.5 million to get our product to market. Our pre-seed plan includes a spending goal of about $500,000, divided up into the expenditures that you see, including product development, regulatory cost, legal, operational, and talent. Our team includes business leadership in Cal Ulysses, myself as founder and chief medical officer, Jim Weimer, who is a biomedical engineer at Vanderbilt, who successfully started and sold 2 businesses. And we have the full support and backup and all the resources that come with it with our Vanderbilt tech transfer. I am the primary contact. George Wilson with the tech transfer office at Vanderbilt is our secondary contact. And we're happy to discuss our product, and I'm happy to take any questions. Thank you.